I now have the pleasure of introducing Phil Whelan, who works in Liverpool. Liverpool has great results for pancreas cancer care, and he is the beating heart of those results. His passion for pancreas care is unrivaled. He is the one who gets all those patients on the oncology clinics and gets our patients to adjuvant treatment after their pancreatic resections. He's a former pancreatic Cancer Care Nurse of the Year, the European award that was given by the European Society of Pancreas Cancer, and he's getting cross with me now. He's also had awards from the Chief Nurse of the UK, and he's going to talk to us about his view and the things he found with us introducing robotic surgery in Liverpool, because that was obviously it's a new thing for us to do, and we already had good results. So it was the apprehension potentially of that as well. So I'll pass over to Phil now. And he's known by the whole pancreas cancer care community of the UK as Big Phil. So Big Phil.
Cheers. Thanks Declan and Ryan. And it was lovely to meet Jarlath again when he came to Liverpool to teach these two, because we knew him as a registrar and he was a great lad then. So it's lovely to see him so successful now. So I'm a nurse. I'm speaking to a room of surgeons, so this is a bit weird, but I definitely wasn't aroused when the thought of a robot coming to Liverpool. I definitely wasn't aroused. I was more worried about why we're going to change our practice. Things are working quite well. We had some very experienced, maybe stuck in the mud surgeons at that point in time who were quite maybe against robotic surgery or changing their practice. And we also had a really good team of kind of nursing staff, CNSs, ward-based nurses who you kind of get used to your own practice, you get used to what you do, you get very good at it, and then suddenly there was a bit of a change in what we were planning to do. So there definitely was a stigma attached to the guys bringing the robot practice in. There was some big hurdles to navigate. I'm quite involved in the planning of lists in my job, and when Declan first came to me and said, we need that list for some level 1 robotic cholecystectomies, I was like, well, no, that should be for, you're very good at your operating, you're a very good pancreas cancer surgeon, that man needs pancreas cancer surgery. Yeah, but we can do it the week after. No, we can't. So we clashed a little bit, and we still do quite a lot. And now with Mr. Barron, I'm a lot more on their side now. So there was a lot of headache with list planning, but credit to both Declan and Ryan, known in Liverpool as Reclan, because they are together. Their wives may not say so. There was some headaches, but they worked very, very hard to alleviate those headaches. There was a lot of weekend lists start getting put into our diaries, and I think that had to happen really for our cancer workload to keep running smoothly. So there's also, you've all talked about limited access to robotic lists. There's a lot of upper GI surgeons, colorectal surgeons, urology surgeons all wanted this fantastic robot. And what Reclam were very good at was negotiating when they could use the lists. And it was amazing to see how sometimes we were only planning to have one list every 3 weeks or something, and suddenly we were having 3 lists a week. And I was like, how did that happen? And it happened because the guys worked really hard behind the scenes. And there was some issues with maybe delaying patient surgery. The guys talked a lot about finding the unicorn, so the perfect patient for them to start practicing on. I said that. And those patients are often coming on cancer pathways. Some of them maybe the neuroendocrine patients, and they are on cancer trackers. So you get the cancer managers coming up and saying these patients need dates for surgery. We've never really had a problem with your surgery list, and now suddenly you've got some issues. And it was maybe because we were waiting to put the patients on a robotic list. And also, Ryan and Declan were very much the go-to surgeons of the unit. There were surgeons who wanted to do vascular resections, the complex cases, the neoadjuvant cases. And suddenly, if they were involved in setting up this robotic problem, I said problem, I didn't mean to, robotic program, it did cause some problems. We then had these go-to guys were busy doing other things. Now, what they both tend to do is works very, very hard. So I don't think necessarily those patients were affected, but probably the guy's physical and mental health was affected, and their wives. So obviously getting the wider team on board and having a shared vision was important. I think one of the slides talked about how having everyone involved in your robotic journey was important. And I think one thing the team did well was involving the anaesthetic staff, the theatre staff, and making sure everyone felt as a team. It wasn't just the surgeons going about this new dynamic thing. It was the whole team was getting on board with that. It was also to recognise in the unit that not every surgeon wanted to become a robotic surgeon. Many of them didn't want to become robotic surgeons, and it was recognising the skill sets of the different surgeons in a nice way, and trying to get certain surgeons leading on specific operations and conditions, and valuing all members of the team, which in a big team and in a team where there is many personalities, and that is sometimes quite difficult. But I think both clinical leads did that very well. And one thing I think I'm very keen on and very passionate about is patient support. We have a very thriving support group in Liverpool, and we have a buddy group, which is ex-patients coming to meet other patients pre-operatively as part of a pre-operative package to try and talk to them about their potential surgery, their potential chemotherapy. And it's something we're very proud of. Suddenly you have a new technique where no one's really seen anyone recover from. No one knows actually exactly what goes on. Still to this day, I have no idea how that robot works. You guys work in the robot, sorry. So it's very difficult how to counsel a patient through that operation who's already got the anxieties of a potential cancer diagnosis and what that comes with it. So one thing I think we did quite well as a team is that the surgeons who led on the robotic surgery were very good at giving a lot of time to these patients. There's a lot of reassurance. There were surgeons coming in, obviously, and seeing in the surgical clinic, coming down to the pre-op clinic, and often meeting and speaking to these patients in maybe that week or two period before they had an operation. And I think that was really important. I think from a nurse point of view, we had a good education from our clinical leads. We had education like events on the ward, which was important as well. We started to change our information leaflets and booklets we gave patients, and we managed to find some good YouTube videos of ex-patients, many in America, which we started to signpost patients to. And also we had the surgeons who regularly come to our support groups to maybe talk about something that the support group want. We had both Ryan and Declan come and talk about robotic surgery, and it was really interesting for them. And the room, maybe 50, 60 patients in, you can often not hear a pin drop because they're really interested in these new novel techniques. And obviously, as patients then started to have a robotic Whipple's for a cancer and they were coming back to the support group, they could share their experiences as well. And in our next support group meeting in June, we've got a talk from one of the patients who's had robotic surgery. So for their lived experience, who's actually quite interested in becoming one of our buddies, so we can match them with robotic patients moving forward, which is quite exciting. I wanted to point out Mr. Barron's receding hairline in that picture because he had a thick set of hair before he started the robot program. So yeah, I think support groups are really important. I also think you've got to celebrate your successes. So in the trust I work at, we're not very good at doing that. And we do a fantastic job in many departments, but very passionate about pancreatic services, both for surgical patients and palliative patients. This is what many patients I look after. And I think one thing the team has done very well is celebrate the success of the robot program and push the robot program, both within the trust and within the local area. It's also about, I think, learning from your experiences. I'm sure there'll be talks about where things maybe haven't gone as well in robotic surgery, and there have been some problems, some teething problems with maybe some potential complications that can occur after surgery. And it's about the team, the wider team, acknowledging that in meetings about maybe what could have gone better, what we need to do next time. And it's also listening to patients, how they feel about their surgery. It's been really, really interesting for me to, when I'm seeing someone in the clinic and their post-operation, I'm maybe giving them their post-op pathology reports and they've had a robotic surgery. it's interesting to see and compare the patient's maybe symptoms compared to an open operation. And we're definitely noticing a lot of themes in early recovery, and very much a reduction in pain at very early stages post-procedure, which is great. And I think we need to learn from that and listen to our patient body. And also, I just want to personally say thank you to Recklin, because I get a lot of probably criticism in our team for their passion for wanting to drive a service forward, and probably a lot of that was from me at the start. So I can always admit when I'm wrong. I very rarely am, but I'm very much on board with the robot program now, mostly because you can do 2 lefts on the same list, and that makes us get more lists. It's great, more patients get through, and the recovery is better, and patients seem to enjoy it. But obviously we need to acknowledge it's not for every patient. And I think I heard Keith Roberts talk recently about kind of some of the standard open approaches, which still are very much needed in the units we work in to try and do the best for our patients. So yeah, thank you very much. It's a very whistle-stop tour of my personal thoughts really about the robot programs in the UK. And thank you to Jawad. Lovely to see you again.
Phil, thank you so much. And everyone, tonight is the premiere of the new boy band from UK HPB, Reckland. They're doing a little duet this evening at the dinner. Phil, thank you so much. Any comments or any questions for Phil on what was an extremely patient-based discussion? Any comments at all? Phil, you're off the hook. Thank you very much.
Thank you.